Hi, this is your Houston Chiropractor Dr. Gregory Johnson, and this is
your future Houston Chiropractor Tristan Wendt. We're in Houston, Texas today at Advanced Chiropractic Relief, and I wanted to take this opportunity to kind of get Dr. Johnson to walk us through what the Johnson Chiropractic Technique is, from the biophysics table to the manual decompression table, the ring dinger obviously. And so I started here about 3 or 4 years ago as a patient with Dr. Johnson, lumbosacral radiculopathy and everything. And this is the treatment that I've been getting for about 3 or 4 years now, and saved me from surgery. It saved my collegiate football career, and I'm really thankful for everything that he's done for me, not only as a patient, but now as a mentor and his protege.
Yeah.
So I'm gonna let him take over, and now we're gonna do kind of like a walkthrough of what the Johnson Chiropractic Technique is.
So first thing, just to let you know, I learned how to adjust correctly at Palmer College of Chiropractic, where they actually still teach chiropractors how to adjust. And I am Palmer proud, and Tristan is actually going to be attending Palmer College of Chiropractic in July of this year. And because it's impacted his life like it did mine. I knew I was going to be a chiropractor in the 8th grade because chiropractic saved my life and changed it forever. And I knew I was going to become a chiropractor and not a medical doctor. However, my education in Palmer and also in postgraduate education has led me to develop over my 38 and a half years of practice the Johnson Chiropractic Technique, which is a combination of Palmer Package, Thompson, Gonstead, Diversified, Pierce Stillwagon, and Biophysics. And Biophysics is how I analyze the biomechanical configuration of the spine on the x-axis, the z-axis, and the y-axis. XYZ, Cartesian coordinate system. That is a mathematical physics equation that allows me to analyze a person's posture, which is a mirror of their spinal biomechanics, and determine from just looking at their biomechanical posture in an XYZ axis where their subluxations are, what I need to do to adjust them to get results for their subluxations in their spine and pelvis. The spine's made up of 24 freely movable vertebrae, and they all interact with each other all the way up and down from C1 down to L5. There are 7 vertebrae in the cervical spine, 12 in the thoracic spine, and 5 in the lumbar spine. Then you have the pelvis, which is made up of a right innominate bone called the ilium, and the left innominate bone called the ilium, and then in the middle, this triangular bone in the middle is called the sacrum. So this is the sacroiliac joints bilaterally.
Should have worn my yoga pants.
Yeah, oh yeah. Thank God you didn't.
But you can do pre and post observation also.
Oh yeah, absolutely. In fact, that's one of the things that you'll notice that I do in every single patient visit, and you know this better than anyone because you're back here with me for the last year. I do pre-posture or pre-adjustment postural evaluations and post-adjustment postural evaluations, as well as pre and post orthopedic neurological evaluations, to find out objectively if we're making some changes and corrections in that patient's biomechanical configuration. When I first met Tristan, he was severe spasm, antalgic posture, had leg pain all the way down into his calf, sciatica, which is lumbosacral radiculopathy. So yes, we as chiropractors, including here in the state of Texas, do diagnose and treat neuromusculoskeletal disorders. We did a video earlier today, which I appreciate you watching and taking action on, to call Representative Sheffield and Thompson and vote for and get House Bill 2733 out of the subcommittees and to be put on the floor for an immediate vote, so that we can clarify our definition. We're not trying to expand our scope of practice. We don't want to prescribe drugs or medication. We don't want to perform surgery or inject patients and do those invasive procedures. We want to treat the biomechanics of the spine that affects the nervous system, which makes you a healthier person when the spine and nervous system is all functioning together in homeostasis.
With the Johnson Chiropractic Technique.
With the Johnson Chiropractic Technique as my key features of how I treat people's spine. So let's show them how we do that, Tristan.
Alrighty.
Let's have you flex your head forward and backwards.
So this is the pre-adjustment.
Now this is the pre-adjustment biomechanical evaluation. Now Tristan's in pretty good alignment because he gets adjusted regularly, but his head's still forward and translated to the right. That's called a negative XX cervical, and you can see because his head's forward, his hands are out in front of him. That's from bending over, working on his computer all day and doing the things that he does here in the office. He's not adjusting patients yet or diagnosing patients because he doesn't have his Texas license or he's not even gone through chiropractic college yet. But he will probably know more about true everyday hands-on adjusting when he gets to Palmer than most Palmer students would do when they graduate. So he's going to take you through his journey in Palmer College of Chiropractic on his YouTube channel, which is called
Your Future Houston Chiropractor Tristan Wendt.
And that's exactly what it's named. And I will leave a hyperlink to his YouTube channel in this video.
This is one's for mine. So.
Yeah, and this is also going to go up on Tristan's too. Okay, so I already know from previous examinations of Tristan that his spine is compressed. And that's one of the very first things that I did with him was the manual spinal decompression technique, which adjusts the spine vertically in the y-axis, horizontally when they're on the table, but takes off gravitational weight-bearing compressive stress. And he played center for Sam Houston State University, so he's had a lot of compressive stress in his career.
Once or twice.
Yeah, a few times. Talk to your mom about that one. But right here, there you go. Okay, slide down just a tad. Yes, sir.
And the pins are to create a fulcrum, right?
Yeah, the pins actually stabilize the iliac crest on each side so that it holds the ilii, plural, stable and also straight. And then I come up here and I wrap this wet towel around his occiput and his mandible, not his neck. And I do a straight vertical decompression on the y-axis.
Sorry.
You felt that one all the way down, didn't you?
It's like a giant plate being lifted off my head.
Yep. Okay, wiggle your left big toe. There you go.
I think one of the key components that a lot of people don't realize is raising the legs also.
Yes.
Helps relax the lower paraspinal
If you don't
muscles.
raise the legs up like that, you have tight paraspinal muscles and it hurts more to
Yep.
do that. There's a lot of chiropractors around the country and around the world that are trying to do their version of the ring dinger,
Excuse me.
but
Sorry.
there's key factors about that table and the way I do it that distinguish what I do from other chiropractors that are trying to do spinal decompression. The legs are even today, that's a good start. And they stay even, that tightened up a little bit. Not
Tiny
bad.
bit. Tiny bit.
Now see, we always do pre and post leg checks too because that is a excellent indicator as to the biomechanics of the sacroiliac joint and the sacrum. So I'm adjusting his right SI joint right now, and then his sacrum straight superior to inferior, his left SI joint, but I'm going to come around the table on this side because his right SI joint has always been the major subluxation pattern he's had, so there. Now if you notice, I'm using quite a bit more strength and line of drive in Tristan's pelvic adjustment from what I did on Renee just previous in the video before this one. So this should feel easier already, Tristan. And then I'm still coming into the lumbar spine here, and I'm on L5 right now. Drive that straight P to A, L4 straight P to A. Then I get up to L3. You see the angles changing on my arm. And then we get all the way. I'm skipping his lower thoracics because I'm gonna get him on the knee chest table over there in a second. Good. Okay, let's turn you on your back. This adjustment is designed to restore the cervical curve in the Z-axis with retrolisthesis. And then I do this adjustment where I'm contacting the zygomatic process, but I'm not adjusting his cheeks. I'm actually bringing his whole head up and beyond in the Z-axis to get his head and spine up over his thoracic spine. Slide down just a tad, there you go. And see, he already knows what to do because he's done this so many times. Now I have taught Tristan the Cartesian coordinate system, how to evaluate biomechanics, biophysics, all of my adjusting procedures, which he does not do on patients here because he's not yet a licensed chiropractor in the state of Texas. However, if he's going to be your next Houston chiropractor, which he is, he's got to know how to do things exactly like I do them, and he already has learned that. There you go.
And each adjustment looks similar.
Yeah, because I'm adjusting the same body parts
Exactly.
with the same technique,
Exactly. But it's
but the
specific.
forces
from
being used are different for every
patient to
patient.
patient. Yep.
Everybody else says, oh, he does the same adjustment on everybody.
Nope.
I use the same technique on everybody and adjust the same body parts on everybody.
But through the exam and orthopedic neurological
Yeah,
tests.
in the history.
Exactly.
We do detailed histories and orthopedic neurological examinations in here. There you go. Okay. Yes, sir. Home run. So, I have now adjusted his cervical, thoracic, and lumbar spine and pelvis on the XYZ axes. Now we're going to do the post adjustment evaluation. Okay, so let's close and there you go. Now, if you look at his posture now, he's not off to the right as much. He's still a little bit right, but not as bad as he was before. But his hands are right down on each side. His pelvis is in the center, so pull these guys up and back. Yes, sir. Yep. I'm gonna go left too. This is a Atlas specific adjusting instrument, so I'm adjusting the Atlas on the x-axis. This sends a bombardment of neuroproprioceptive impulses into the cerebellum. The cerebellum controls balance, posture, coordination, and all kinesthetic movement throughout the body. That's what Tristan has his master's degree in, is kinesiology. Okay, try that again, Tristan. Now, after I do that, most patients report that that's a much smoother flexion and extension movement.
Every time.
Yep.
And I have more range of motion as well. Doesn't feel restricted.
So Tristan, you've been to orthopedic surgeons and PTs and other chiropractors, neurosurgeons, and they wanted to do injections and surgeries on you, which you did do a couple
I did
injections.
2 injections, no help at all.
And then you found me on YouTube and
I
came
did,
in.
Yep, a month before my scheduled surgery with a neurosurgeon, I was gonna have a discectomy at L4, L5, and I was lucky enough that they were somewhat honest with me and actually told me that, you know, you're probably not gonna come back 100%. At most, you're probably gonna see maybe an 80% improvement after the surgery.
And that's just with the pain sciatica that you had.
Yep, and the range of motion and everything. They
But
at
they
least told
didn't
me
give you much chance to return to football.
Nope, no sir.
Yeah.
So luckily I found you on YouTube.
Yep.
And here we are today, 4
And
years
here we
later.
are today, 4 years later, and we've got another 4 years of Tristan's journey through Palmer College of Chiropractic, and he's going to share that experience with the world
Yes, sir.
on his YouTube channel, but also we're going to be doing a full-length feature documentary on Tristan's journey through Palmer College of Chiropractic, and then also his coming back here to Houston and taking over Advanced Chiropractic Relief LLC and becoming your next Houston chiropractor.
Yes, sir.
And I'm just, Renee and I and Greg are so blessed to have Tristan in our lives, and I couldn't have found a better protege. He believes in God and puts God first in everything that he does, just like we do. And patients love him. He knows everything that goes on in this office, from the front desk to the EMR to what I do back here with patients and the histories and examinations and all the techniques that I use. I have shown him how to do every single one of those, and he's a smart guy. He's learned everything, and he will be, now I don't say this very often because I always have said, and in my affirmations going through Palmer College of Chiropractic, I always said, I am the best chiropractor in the world. I am the best chiropractor in the world. I am the best chiropractor in the world. I'm giving Tristan information right now, and what he will learn at Palmer will make him the best chiropractor in the world, next to me.
Yes, sir. Right there with you.
That's right. So we're going to continue to provide neuromusculoskeletal diagnosis, treatment, and rehabilitation of the spine-related disorders and the biomechanical configuration of the spine and the pelvis, as well as extremities. And we hope that you will follow Tristan's YouTube channel and take this journey through Palmer College of Chiropractic with him.
Yes,
support him like you do us. We love y'all crack addicts. We love your comments. And yes, we really do love your comments, even though some of them are kind of lewd and crude sometimes. We still love them. Because you guys are what makes us successful on YouTube. And our videos are educating the planet as to the benefits of chiropractic care. And we want to thank you for that, because it's all due to you.
Sir.
This is your Houston Chiropractor, Dr. Gregory Johnson, and
Your future Houston Chiropractor, Tristan Wendt, coming to you from Advanced Chiropractic Relief in Houston, Texas. And we'll see y'all soon.
yeah, and let's do it. Changing the world for
Yes, sir.
chiropractic.
Yes, sir.
See y'all soon.